Hi, my name is Amgad Nakhla. I'm a consultant orthopaedic surgeon at the Clementine Churchill Hospital here in Harrow. Today I'll be sharing with you some key information about having a daycase hip or knee joint replacement. I've performed several thousands of hip and knee joint replacements, of which well over 100 are day cases. I've seen firsthand the benefits of having these done as outpatient, meaning you can go home the same day of surgery. Firstly, why might you need a hip or knee replacement? People have their joints replaced for many reasons, but the most common are osteoarthritis, which is when the smooth cartilage across the surface of your joint wears down over time. You'll sometimes hear it being referred to as wear and tear, and it's more common the older we get. The wear and tear can make your joint very painful and stiff and can really reduce your mobility. This is the most common type of arthritis, both in the UK and worldwide, and it's the most common reason why people have joint replacement surgery. Secondly is rheumatoid arthritis, which currently affects more than 400,000 people in the UK. It's an inflammatory joint condition caused by an autoimmune process which happens when your body attacks its healthy cells by mistake. This often causes pain, swelling, and inflammation in your joint. People may need a hip joint replacement following a fracture. Fractures occur either post-traumatic, following an injury during contact sports, but they can also happen because of osteoporosis, which is weakening of the bone. You will be recommended to have joint replacement surgery when the pain has got to that extent that it wakes you up at night and limits your activities of daily living, and when other conservative treatment options like steroid injections or physiotherapy have failed. What is a daycase procedure? The time people spend in hospital after a hip or knee replacement has significantly reduced over the years. And now, especially here at the Clementine Churchill, you can have this as a day case and go home on the same day. There are many advantages to this, including being back in the comfort of your own environment sooner and a faster recovery period. And it also reduces other risks like blood clots in the leg and infection. So what happens during joint replacement surgery? During joint replacement surgery, we gain access to the joint, and then the damaged diseased joint is replaced with a prosthesis or an artificial joint. This prosthesis is constructed of metal, ceramic, plastic, or a combination of the three. The operation can vary in time from under an hour up to more than 2 hours, depending on the extent of damage to your joint. Outcomes are usually very good, with most artificial joint replacements lasting well over 20 years. You can feel the benefit of a joint replacement surgery very quickly with immediate pain relief and reduced stiffness in your joint. After your recovery, you'll be significantly more mobile and able to get back doing more exercises and activities, all the things you love. So how is a day case procedure performed differently from a standard joint replacement? So we generally operate on patients planned for day cases through minimally invasive approaches. This minimizes the damage to soft tissues around the joint, and for knee replacements, we do them without a tourniquet. We do them under a short-acting spinal anesthetic, and you can choose whether to be awake or sleeping during the procedure if you get sedation as well with it. This is different from general anesthesia, where you need to be intubated and patients stay longer in hospital afterwards. We also administer a large cocktail of drugs around the joint to make you pain-free. And we also give you other medications to reduce blood loss and the risks of nausea and vomiting after the procedure. When the surgery is over, you will be monitored closely by your healthcare team before you're being told it's safe to get up and walk and eventually go home. You will meet your enhanced recovery physiotherapist who will get you up and walking and on the stairs. Yes, you will be able to do the stairs before you go home. They will also give you some exercises to do at home to regain your strength and mobility and to get moving as quickly as possible. We will provide you with plenty of information about how to recover safely at home, including advice about caring for your wounds and managing your pain levels safely, so you'll feel informed and ready for the next steps. And we are always a phone call away if you need any help. You will need someone to pick you up from the hospital, or we can arrange a taxi for you if you prefer. Is the recovery period faster after a day case joint replacement? The recovery period is technically faster because you can get home sooner and back to your normal activities much quicker. We've had patients go back to cycling just 2 weeks after surgery. Every individual's joint replacement recovery timeline looks slightly different. The factors that affect it include how fit you were before having your replacement surgery, your usual everyday activities, the nature of your job, and your age. We will be able to understand your personal circumstances better and personalize your recovery. Most people will be able to get up and walk independently on the day of surgery. However, you can use walking aids up to 6 weeks following surgery for safety. You can start incorporating gentle exercises back into your routine straight away after surgery. It's different for everyone. Your surgeon and your physiotherapist will explain to you exactly what to do and when. You can also usually go back to work pretty early after surgery. Most people with an office job can go in at about 2 weeks after surgery. If you have a manual or a physically demanding job, you might need up to 6 weeks off. You should discuss with your consultant when you can drive after surgery. For insurance purposes, we usually advise you not to drive for 6 weeks, but many patients can do it earlier. As soon as you can perform an emergency stop without any pain or other issues, you can contact your insurance and tell them that you're okay to drive. Within 12 weeks of surgery, you should have made an excellent recovery and be able to go back to most things you want to do. With knee replacements, you will carry on improving up to 18 months following surgery. Why is it important to have physiotherapy after surgery? Physiotherapy is a very important part of your joint replacement recovery journey at Circle Health Group. How well you follow the guidance of your physiotherapist can have a huge impact on how well and how quickly you recover. Your physiotherapist will let you know how regularly you should perform specialist joint exercises outside of your follow-up sessions, and they'll help you source any equipment you might need to help you do them. They'll also give you advice on how to incorporate exercises into your daily routine at home so that physiotherapy becomes a normal part of your day. We hope that this video offers you everything you need to know about having a day case joint replacement at the Clementine Churchill Hospital in Harrow. It's important you speak with your consultant about whether surgery is an option for you based on your general health and fitness levels and the extent of damage to your joint. If you have any more questions, please feel free to leave them in the comment section below and we'll do our best to get back to you. If you would like to arrange a consultation with me to discuss the procedure in even more detail, you can book an appointment with me at circlehealthgroup.co.uk.